Well, good evening, everyone. Thank you for joining us this evening. I am your co-host, Robin Blank Mascari, along with my partner, Gregory, and we get together every Tuesday evening to give you an introduction to a very special company. And every time I see that video, it just reminds me yet again how different, unusual, innovative we have with LifeWave. So we're going to do an introduction. Gregory will do a short presentation of the history of the company, a little bit about the technology, the star of the show, our product called X39, and a little bit about our founder, inventor, David Schmidt. And then we'll bring on our special guest this evening, Dr. Jeffrey Hubbard, and he'll be sharing some things, and then it's your turn. So you get to share stories and ask questions, and please use the Q&A to do that. And remember, symptoms only. And so let's get started. Gregory, I'm going to turn things over to you.
All right. Thank you, Robin. And good evening, everyone. And I apologize in advance if our broadcast is a little bit, wonky tonight. We're talking about light therapy, but we here in Montana are still on DSL wired internet service, and it's a little bit weak today. So hopefully the broadcast is coming through okay. And I'm going to go ahead and share my screen, and we'll talk about X39 and our breakthrough technology that activates your stem cells. So here we go. And so before we get started, I just want to share with you an awareness I came to a few years ago. I finally figured out what I want to be when I get older, younger. And I bet many of you can relate to that because getting old isn't so cool. And if anything were possible, I'd like to ask you a question. What's one thing you would choose to experience differently in your health or in the health of someone you love and care for? And what difference would that make for you if that could be enhanced or changed? And we're going to share with you a technology that just could do that. And with that being said, I do want to make note that our products are not designed or intended to heal, treat, diagnose any disease. However, they do help our bodies to get back into a more healthy, regenerative mode. And many times, wonderful things begin to happen when that happens. So let's talk about the stem cell revolution. And because we believe everyone wants to look, feel, perform, and live younger, and we found that stem cells are the key. And that's because they're a vital part of our immune system that helps to repair and regenerate damaged cells in every organ, gland, muscle, bone, all throughout our entire body. Now, here's the problem. The older we get, the less stem cells we have. By age 60, only a small percentage remains. And the fewer stem cells we have, the faster we age and the slower we heal. And neither of those sound very cool to me, okay? So what about stem cell injections? Because they are becoming quite popular, but you know what? They're quite expensive. You could spend thousands or tens of thousands of dollars with no guaranteed results. It can be painful, risky, controversial. Again, no guaranteed results. Now, this is where the good news comes in. You can look, feel, perform, and live younger with a historic breakthrough in stem cell activation technology. It's a new wearable technology in patch form. It's affordable, safe, non-invasive, and it's drug-free. It's a patented form of phototherapy that uses very specific frequencies of light to increase and improve stem cell activity. Now, this is the brainchild of our visionary founder and CEO, David Schmidt. And David is not only a brilliant scientist and researcher, he's a genius inventor with over 130 patents and patent pendings. And he's been on the leading edge of phototherapy research and science for over 20 years. And he's already conducted over 80 clinical studies proving the efficacy of our LifeWave phototherapy technology and products. And many more studies are always in the works. That's because LifeWave is a very research and science focused company. It's a 17-year-old advanced technology company. It's founded back in 2004 based on an energy enhancing technology that David actually developed for Navy SEALs to increase their strength, stamina, and performance without drugs, stimulants, or caffeine. It turned out to be so effective, it's now used by world-class athletes around the world in almost every sport. We have corporate headquarters, laboratory manufacturing, diversified between California, Utah, and Ireland. And we have global distribution to over 75 countries from our 15 global distribution centers. Now, the word certainly is getting out about LifeWave, and we're glad to have you on the call tonight learning about it. And LifeWave patches are now used by pro and amateur athletes around the world in almost every sport. The media's begin to notice, and you might too, if you look carefully at some of your favorite athletes and Olympians, and you see these auspicious little white patches, that's LifeWave. That's our light energy products and technology. So let's talk briefly how this amazing technology works. And it is based on a type of light therapy called photobiomodulation. And LifeWave patches contain very specific combinations of organic materials and nanocrystals. And when they are applied or near the body, they're activated by our body heat. And they then begin to emit very specific wavelengths of light, which stimulate targeted and beneficial biochemical responses in the body. This is known as photobiomodulation, and it is the foundation and basis of our LifeWave phototherapy patches. And it's been a well-recognized and a proven scientific principle that different specific frequencies of light can cause very specific changes within the body. For example, when you go out in the sun, one specific frequency of light causes our body to manufacture vitamin D. We don't get a vitamin D download from the sun. We get a light frequency download, and our body manufactures it based on that stimulus. Another frequency of sunlight causes our body to make melanin, the chemical that gives us a suntan. And LifeWave's patented technology is based on this same rock solid, well-recognized and approved scientific principle. Now, our focus for the last 14 years has been in the field of anti-aging and regenerative science. And a little over 3 years ago, we released to the global market the LifeWave X39 stem cell activation patch. And this truly is a historic and affordable breakthrough in stem cell activation because, some are calling it the holy grail of anti-aging restorative science because we're actually doing what the multi-billion-dollar companies and big pharma have not been able to do. And we've discovered that X39 actually activates a specific copper peptide that activates your body's own stem cells. No injections required, just the application of this little patch stimulating your body's production of its own stem cells while also altering gene expression towards a more younger and vibrant you. Now, it certainly is a game changer. And David Schmidt, our founder and CEO, says X39 is a true breakthrough, and it's his greatest accomplishment or achievement yet, and the emphasis on yet, because David still spends more time in the laboratory than in the office, and there's no telling what breakthrough science is going to come out of his laboratory. And yes, we have patents. Yes, we have clinical studies. Yes, we have field results proving that X39 is actually turning back your biological clock, helping people to look, feel, perform, and live younger. And for us baby boomers, this is very exciting news. So, Robin, that's my contribution to this evening, and I'd like to turn it over to you and our good doctor. Is he on with us now?
Yeah, would you promote him, please? He's here.
Okay, I'm looking for.
Yep, Dr. Jeffrey Hubbard is here. He's in the house.
Is it under DR, doctor?
You'll find him. Yep. I couldn't do it, so I'm asking you to do it. So while you're doing that, I get to do the introduction of this very special man who just got back from the Philippines. Dr. Jeffrey Hubbard is an MD. He's a concierge MD. He's an educator. He's integrated, functional medicine into his practice. He's an educator. He's a CEO of Comedicare, which is an innovative health and wellness ecosystem. He is a gift to our community. He's constantly, really educating people on wellness and how to prevent diseases. And we are thrilled to have Dr. Jeffrey back with us. Hey.
Hi there. How are you?
I'm great. It's great to see you.
You too. You too. What's going on?
Oh my gosh, a lot.
Fun without me.
Well, so you just got back, and you're building all over the world. You're sharing the great news of LifeWave all over the world. What got you excited, Dr. Jeff, about getting involved with LifeWave?
I think it goes directly to Gregory's last slide. The clinical trials, the patents, all of the research and things that is there available for anybody to read and understand. That was really powerful for me. I had been a part of many other companies in the past, and supplements here and potions and lotions and all of the things we say, and none of them have ever had the scientific backing that LifeWave has readily available. You don't even have to ask for it; it's already there. So that was just really made me feel comfortable. It helped me to understand exactly how the technology worked, and it really introduced me to photobiomodulation in general, which I realize now is an amazingly huge industry and field. There's so many different things and contributions in that space, and understanding what light can do for the body when it given the right frequency.
Beautiful. And I know you have a zillion stories, but could you just share one or two of your favorite experiences of using the patches that kind of made you go, wow?
Yes. So
I know you have a lot.
personally, I play baseball as my first love. Since I was big enough to throw a baseball, I've been doing it. My grandparents, my family, everybody are big time Houston Astros fans from where I grew up in Houston. And so anyway, long story short, over the course of 20 or so years, I started to damage my rotator cuff. And I had issues washing my back. I had issues sleeping. I had issues reaching things above my head. And I don't have really any other tangible explanation other than consistently wearing the patches, that now I can completely use my shoulder and it feels good, and I can wash my back and all of that good stuff, so I don't have to use, I used to use one of those washer sponges. Don't have to do that anymore. And then I'll share a really powerful story from my trip to the Philippines. We were in a town called Iloilo City, and we conducted an event. After we talked about the patches, we kind of had what we consider open patching. So we offered patches to the audience if they had a particular ailment or pain or something that they wanted to address. And so there was a lady who came up, and she told us that she has long-standing diabetes, and she pulled her shoe off and she had a huge ulcer on her foot. And I was like, oh no. So she was so upset about how painful it was, not getting it able to heal, all of those sorts of things during the moment. So, I put a couple of X39 on, and I put some weight on. And the next person, we're kind of talking with them and kind of trying to understand what their situation is. And just moments, maybe 2 or 3 minutes, the lady asked Mike back, and she's boohoo crying. And she says for the first time in 3.5 years, her leg doesn't hurt.
Wow. Wow.
So that was just really powerful, and it's a spiritual sort of experience, because to go around the world and to see the way that the patches help people, and to see that somebody being in pain and in a level of discomfort for so long, to get the relief that it brings her to tears, that was something I'll never forget.
It's one of my favorite things is we get to wake up every day and know we hear miracle stories, and what a wonderful way to live, huh? And so it's the same all over the world. It works on everybody's body, and as she stays on X39, that wound is going to get healed too, we know.
Yeah.
Yes.
And
that may take a little bit longer though.
Yes, no, a lot more longer. And I told her that. I said consistency is the key. Just being able to get the circulation back into that, and get the proper nutrients and things that she needs in order to have it heal. And we talked about a lot of that. So hopefully she's adhering to the suggestions we made.
Beautiful. So this product X39, who's it for? Who isn't it for?
I just said this on my platform maybe 20 minutes ago. I said I think everyone should be wearing X39 for a couple of reasons. One, it has a really great general wellness and preventative approach. I mean, having more circulating active stem cells is just going to make your body function more appropriately. So even if you don't have any ailments, even if you don't have any symptoms, even if you don't have anything that you specifically want to address, I know for a fact that X39 will help you from
Is there anyone who shouldn't be wearing it?
great question. So just two caveats to saying, and one, those are people who are actively going through chemotherapy. That's a no-no. And someone who's had a kidney, liver, heart transplant, something where you're taking anti-rejection drugs, that again would be a no-no. It's just the pharmaceutical approach that you've already embarked upon.
Okay, so it's really for mostly everyone, and it
Correct.
is non-transdermal. Can you explain that to people?
So typically patches transmit a drug or a product across the skin, how you get the experience of the patch. This is completely different. This is like wearing a mirror on your skin because you're reflecting that light back into the skin. So there's no drugs or chemicals or anything that actually cross the skin barrier. So that's the major difference between most patches and
Beautiful.
what we have.
So there's nothing going in the body other than a frequency of light. So there's no contraindications, correct?
That's correct. No medicines, no supplements, no issues at all other than those two that we mentioned.
So that makes it really safe for almost everyone. Now, what do you recommend are the ideal conditions for people to get the maximum benefit of utilizing this technology?
So hydration. That is so important. You know, we're such a large component of water. We have to make sure that we have healthy, good water in our system. So typically that means 2/3 of your body weight in ounces per day. And then mineralization, you know, so there's so many symptoms and things that we can develop from mineral deficiencies. Specifically magnesium, zinc, and copper are really great in helping the patch to most effectively be
Beautiful. So consistency, hydration, and how long do we wear it?
12 hours on, 12 hours off.
And I know a lot of people will say, well, why do you have to take it off if it works so well?
So the key is that just like you experience the sun during the day, that's your light therapy from the sun. And then you have to go through an appropriate nighttime. It's just the way our physiology works. So you need a daytime and a nighttime. So that helps to explain that. So you want to take the ample, the same time break for the same amount of time.
Okay, so we need to give our body a break from the signal so it works really well. And you know, everyone's different, we know, but what can people expect as far as noticing some benefit? It may not be exactly what they want, but what's it going to take to notice something? How long?
So that's a really great question. So I'd say of us are going to feel something within the first week to 10 days. Something tangible. Maybe I wake up, I'm feeling better. I rested well. You know, maybe my aches and pains have reduced. Maybe I'm feeling a little more chipper. Maybe my mind is more clear. But for the real big stuff, 90 to 120 days. That's where I would say the minimum before you say, oh, this is not for me, or this is snake oil, or whatever you might say. Give yourself ample 3-4 months. And you know, here I am. I'm almost 3 years in, and I still notice things. I still have an appreciation of myself feeling better, stronger when I am wearing the patches.
It's so wonderful because it is cumulative and it gets better and better and better. And so we do recommend that everyone get a health tracker. And many of you are guests this evening. So I asked the person who invited you to send you a health tracker and get yourself a baseline. And then in 24 hours, a lot of people notice something. It could be better sleep or mobility or energy or mental clarity. It could be many different things. But then over time, things get better and better and better. And I love showing my finger. This finger was stuck like this for 20 years. and now I can do that. It's like, oh my goodness, it's really fun to have things get better and better.
If I may, I just want to point out, everybody can see the picture of you and Greg together. And I'm just looking at you today, and I don't know how long ago that picture was, but I can notice some differences.
You know,
Powerful testimony in itself, right?
well, I'm going back to my hometown soon. I haven't seen people in a while. It'll be very interesting.
Yeah, they're gonna be like, who is this lady?
It's pretty fun, isn't it?
Yeah. What
You
have
know, and what's more important is how you feel. You know, age is not a number, it's a feeling. And when I started, I was not feeling well. Not only did I have the bone on bone pain, but I had overall body aches, and, you know, I just felt old. And now, you know, I'm up at early in the morning, putting an hour of cardio in, and feeling really good. So
Awesome. I love to hear it. Well,
yeah.
that's my experience with the X49. I have been working out like an animal since I started wearing it, and I am noticing things that just has not happened for me since I was in my 20s, as far as being able to exercise and have stamina. So that's my plug for the X49. If you're looking to be stronger and faster and more muscularly defined, X49 is a really powerful patch.
It does a lot of wonderful things. Oh, great. So are you ready for some questions?
Yes, let's do it.
I got a whole bunch. So everyone, if you have questions, they go in the Q&A section with symptoms only. If there is a disease state mentioned, I won't ask it, just so you know. Okay. Hi, Dr. Jeff. Any suggestions for a 75-year-old male with severe blood sugar issues causing numbness and severe pain in the feet, legs, and especially at night?
Yes, it's interesting. I'm going to suggest everybody check out my YouTube channel. There's a bunch of content there to review. Today, we just talked about something very similar. In this instance, I really like this 3-patch combination. It's X39, glutathione, and carnosine. So here's a brief example. So X39 just does an amazing job of connecting into our cellular intelligence. That's something that I'm really starting to see, because it doesn't do the same thing for everybody. And you may want it to do one thing, but it decides to do something else. Anyway, long story short, that's going to help the functionality of your pancreas, the functionality of gastrointestinal system, and helping to digest the food first. Then it's going to help with cardiovascular remodeling and circulation. That's a huge piece for the second part. Glutathione is a classic antioxidant. It's going to help clean out your cells. It's going to get rid of heavy metals and toxins and things like that. It's just going to help your system to function more appropriately, help your lymphatics, your immune system. That's going to be huge as well. Number 2, with the glutathione, it helps with something we call insulin resistance. So when your insulin is floating in the bloodstream, this hormone is responsible for binding with the insulin receptor and bringing glucose into the cell. So if that is not functioning properly and glucose remains in the bloodstream and does not find its way into the cell, that is the definition of high blood pressure, is insulin resistance getting out of control. So to nip that in the bud, glutathione is really powerful. And it also helps with circulation as well. And then carnosine is probably going to be your best friend, because carnosine has been shown clinically to help with inflammation of peripheral nerves. And it also helps to glycosylate certain sugar molecules. So it helps break down the process, and it also helps you to recover. So in most instances, we look at carnosine to help with athletic, recovery, but it could just be from any stressor, like having your blood sugar be too high.
Beautiful, beautiful. Now I want to give people your YouTube channel and put it in the chat. What is it?
Glutathione.
What is your YouTube channel?
Oh, my YouTube. You can just search my name and it'll pop up.
Okay, Dr. Jeffrey Hubbard.
Yep, and put the MD and that'll help, because there's a veterinarian and a chiropractor, both Jeffrey Hubbard.
Okay, so search Dr. Jeffrey Hubbard, MD, and you'll find his YouTube channel. And there's a lot of treasures in there, like a lot. Okay, and if people want to reach you to set up a consult, how do they do that?
So the email for LifeWave related questions is drjbhubbardmd@gmail. So drjbhubbardmd@gmail.
Okay. drjbhubbard@gmail.
MD.
Oh, thank you. I knew I forgot something. Okay. All right, so let's go to the next question.
Please.
Angela is asking, do you have any recommendations that may help an 18-year-old female with cycle issues, rarely has one, and possibly experiencing issues with fluid-filled sacs on the ovaries, lots of discomfort with cycles. The young lady does not want to go on hormone prescriptions either.
Yes. So there's this phenomenon in acupuncture where you use triangular manipulation of the acupuncture points. And so in this instance, we use ice wave or
Hmm. Did we lose Dr. Jeff?
hear me?
Can you hear Dr. Jeff, honey? There he is. You can't, we lost you for a minute, so please repeat.
Okay, let's go back.
Yeah.
This phenomenon, how about now?
Jeff, I think everybody else can hear you. Our download speed is very limited, so you're breaking up a little bit for us, but I don't think you're breaking up for everybody else.
Oh,
Okay.
good.
Cool. I'll recap anyway. So this triangular position, right? If you manipulate those acupuncture locations, it's really dynamic and it'll have a synergistic effect. So we use ice wave and or energy enhancer. So if it's in the evening, ice wave is during the day, energy enhancer. So let's just say this is the navel. You want to be on either side of the navel, tan on the left, white on the right, either ice wave or energy enhancer. And then come down to about conception vessel 2. So this is going to be even further down from where we put the traditional placement for X39. So maybe another couple of finger widths beneath that. And you want to use combination Eon and glutathione. Really, really awesome, powerful anti-inflammatory component when you stack those two together and put them there. And so it should be a triangle pointing down or arrow pointing down. I've found that is great for reproductive support. So for heavy or discomfortable menses or for challenges, with the ovaries or the uterus or any reproductive organ, that's a great way to approach it. You can also add SP6 complete. That also is a really great patch. So maybe you wear that orientation, the triangle during the day, and you wear SP6 at night or something along those lines. Obviously, X39 would be great as well.
Beautiful. Thank you, thank you, thank you. Okay, Dr. Babb says, one of my patched down, I didn't sleep better using Silent Night. Is there a best placement for it?
That's a great question. You kind of trial and error it. That has been my experience. Some people, and if you read the clinical reports on Silent Night, there is a certain percentage of people who respond really well and their melatonin goes up and their circadian rhythm evens out. There's other people who it takes a longer time and some people who don't respond. So you can add in Eon or you can add in Aloe Vita, which both help sleep, and maybe that will work. I wear my Silent Night here on the forehead, but you can also wear it on the back of the neck. You can wear it here, conception vessel 22. Those are the 3 hallmark locations that I know of for Silent Night.
Okay. And you said something interesting because sometimes people's challenges with sleep is not melatonin related.
There you go.
It could be stress, it could be too much, device blue light, it could be a busy mind, and David Schmidt does have a really wonderful video on creating the optimal conditions for sleep and the different patches for different kinds of challenges that people have with sleep. So you can find that on our liveyoungersuccess.com under David Schmidt videos, which is a great place, or in liveyoungerproducts.com, which is just totally about products, nothing about the business. Thank you. That's really helpful. Okay, Janet wants to know, I have several people I want to start on the HAT protocol from a head trauma or to severe tremors. I can't find anywhere for how long to wear it and how often to change the patches.
Great question. So in general, what I have come to believe is the case is that each patch has approximately 24 hours of efficacy in it. Okay. So you stretch that out about as long as you like. Okay. So if you're wearing the hat, it's challenging to wear the hat while you're sleeping. So wear it as much during the day as possible. So if you can wear it for 6 hours, to me, that's about 3 to 4 days before you need to change the patches out. Also
Beautiful.
take into consideration this element caveat, it's how you feel. So once the patches start working in the HAP protocol, you're going to notice an increase in your cognitive ability, or the person who you're applying the hat to, they should have more vibrancy, more communication, whatever the case may be that was lacking in the first place. And when you start to see that, or that's not there, then that's when you should change the patches.
Beautiful. So they'll notice.
They
So
should.
if you wear it for 6 hours a day and you figure 24 hours, there's four sessions,
Mhm.
and then change the patches when you're no longer feeling the benefits,
Exactly.
whenever that may be. Okay, great. Emily says, I have a potential customer with several health issues, including a lung issue that I think could be helped by X39. Another issue is she has to pee urgently often. She limits her water intake. What do you recommend for that?
Okay, so lung-related issues, lung points are on either side, right where the shoulder and the pectoral muscle meet. So you can do energy enhancer, you can do ice wave, both of those work great symmetrically, tan on the left, white on the right. You can do X39 there, you can do, Eon there, Carnosine works really great. So just kind of play around with those orientations and see how the lung health improves. As far as the maybe incontinence or urgency, frequency, and urination, those sorts of things, it can be a little challenging with ladies, but if you can apply the patches to the inside of the underwear or in the general vicinity of the urethra, usually that gives some really great relief, because that's really the nature. Is it an inflammatory sort of issue, or the floor muscles need to be strengthened? So X39, Eon, glutathione, those are really great patches for issues with urination or bladder challenges.
Beautiful. And they could put it on the outside of the underwear too, can't they?
Oh, absolutely. Absolutely.
Yeah. So the patches do not need to be touching your body. You can put them on their clothes and they're just as effective. Isn't that wonderful? Okay, thank you, thank you. Diane and Steve are wondering, can the patches be used if you're a nursing mother?
I don't see why not. There's no sort of evidence to speak of that would suggest that the patches are not healthy for the mom or the baby. Take into consideration specifically, I get a lot of questions about the X39 in pregnancy. That is where the stem cells are most vibrant and powerful during the whole process, is in the umbilical blood and in the placenta and in the tissue connecting the mom to the baby. So I don't see any suggestions or rationale reasoning to say that a breastfeeding mom shouldn't have these naturally circulating molecules in higher frequency or higher sort of production while she's nursing or doing anything with the baby.
Beautiful, thank you. And no company tests products on pregnant or nursing women. So it's a personal decision, and check with your practitioner, and there's nothing going in the body, so it is safe. But you have to make a decision that feels right for you. Okay, what would you suggest? This is from Bonnie. If someone has broken out with a rash all over their body after using X39. Yes, it's working.
So that's an example of what we call a healing crisis, guys. And you know, we subject our bodies to a lot of stuff over the course of our lifetime. And when we introduce certain molecules and things like glutathione, or in this instance, GHK copper peptide, um, it is going to create a detoxifying effect in the body, which is going to push things out, maybe help to uh, modulate the way the immune system is responding. So that could lead to rash. It could lead to a headache. It could lead to maybe some bowel habit changes. It could lead to lethargy and you needing to sleep and just kind of get it out of your system. So in that instance, I would be really diligent with water. I would try to drink as much water as possible and flush my system. A good lymphatic massage could be great. Some rebounding, some things like that to help cleanse out the lymphatics. A lot of the times we're just housing junk and it needs to come out, and it chooses to come out through the skin, unfortunately. So sorry about that. But as Robin said, you're on the track. You're on the right track to feeling much better. So
Yeah. And the beauty of the patches is if it's too uncomfortable, you can take the patches off. But if you leave them on as long as you can, you'll get through it quicker. And so you can take it off and then you'll feel better. Okay. So someone's asking, how do I get questions and answers before the Tuesday night talks? What time and where, please? Is that askdrjeff.org, Tuesday at 5:30 p.m. Pacific? Is that correct?
that's correct. That is when we have our 45-minute to hour weekly discussion where, very similar to this, we just answer questions, we have Q&A, and we just kind of help to edify the Lifeway family about how the patches work and what you can do for certain situations. Now, if you have a personal question or you have something that you'd like to ask me directly, you can just use my email, which is also in the chat, is drjbhubbardmd@gmail. That particular email is specifically for LifeWave related questions.
Beautiful. Thank you. You're such a contribution to the community. People have gotten so much value from learning and listening to you. Thank you. Thank you. Thank you. Okay. Winnie wants to know, can you use the patches a second day?
Yes. Yes.
Okay.
Long story short, yes. And again, 12 hours on, 12 hours off, then 12 hours on, 12 hours off the next day. It kind of is up to your personal preference. I like to think of the patches like a battery. So, if you want a brand new battery every morning, great, more power to you. I think that's the way that the company intends for the patches to be worn and how to get the maximum effect. But there is more life in the patch after 12 hours. So if you'd like to wear it for a second day, what I oftentimes recommend too is a cycle. So the second day you put it in another location and put on a new one. So that's another great way to maximize the full life of each patch, is before you throw it away, smack it on a knee or on your low back or whatever other area may be bothering you while you put a fresh one on the back of your neck in the hallmark location. Also, for those of us who have pets, you can wear for one day and then you can put it on your pooch or your kitten or your horse or whatever you might have in the backyard, and they'll be happier for it.
Our 5 animals all wear patches. And you can put it on their dog tags or their collar. We put colors on our cats and they don't seem to have a problem with it. Some people like to put a bandana around them and just put it on there. It doesn't need to touch the fur, just needs to be close.
Yep.
And amazing things happen. There's some miracle stories, crazy. Okay, Kim, you got time for 1 or 2 more?
Sure, let's do it.
Okay. Kim's asking about a burn victim. What do you recommend?
Ooh. That's a great question. I guess it depends upon the severity and how much of the body is engaged. If it's just a burn in a general, of this, like say for instance, I burn my hand, I would put the bandage on it, and put something to protect Last thing you want is for it to get infected. So put some sort of bandage or covering on it, ointment, etc. And then either you can patch on the bandage or you can patch within the vicinity of it. And that should help the healing process pretty quickly.
Beautiful.
If it's a bigger, sort of deal, then I would kind of be a more aggressive and put a couple of X39 to kind of help the process, and glutathione and Eon to help with the swelling and inflammation and make sure you don't kind of go off the deep end.
Beautiful. Thank you. Thank you. Ruth Ann wants to know any suggestions for dizziness and poor balance.
So great question. Two main reasons why you get dizzy. One is that your inner ear has a fluid, and that fluid gives off a signal because as your head moves in one direction or the other, the fluid, as you know, it is telling you my head is off center to the left, off center to the right. So if you have ringing in your ears or infection in your ears, that can cause a positional discomfort that makes you dizzy or makes you feel like you're lightheaded or about to fall. The other element is the cerebellum, which is located in the back portion of your skull. So if your cerebellum gets disturbed, that can mess with your proprioception and how you understand your body in space. So either you can patch behind the ear. If you think it's an inner ear problem, we've talked about ringing in the ear. So you can place right behind either ear on that bony process on the skull. And that should help with, your eighth cranial nerve to recognize that, hey, I'm okay. And there's some understanding of why I'm a little dizzy or off balance. If you patch in the back of the skull, usually right at the base of your hairline, you can kind of massage there and feel it. That's a great place to patch for the cerebellum. And hopefully it's not a serious deal. And X39 can help to improve the way that you are handling your balance. So try those two. If that's not the case and that doesn't seem to improve, we need to dig a little bit deeper. So send me an email about that.
Okay, beautiful. And Kathy wants to know, is there anything that would stop or slow senior moments? And what would help with swollen ankles?
Okay, so there is an amazing YouTube video that I think everybody in LifeWave should watch. It's about a 30-minute sort of analysis of how this particular individual's mother is recovering from cognitive decline by using the patches, specifically X39. So they interview her first, and she's having a hard time remembering grandchildren. She can't remember that she doesn't drive anymore. She can't remember that they took her checkbook away. And then slowly but surely, 3 weeks, 6 weeks, 12 weeks into her wearing X39, she's now knowledgeable that she's not allowed to drive and that she's not allowed to pay her bills anymore. She's naming her grandkids and her children and what they do and where they live. It's really powerful. So X39 in itself should be to senior moments, okay? And of course, if there's other things that may be contributing to the senior moments, then that's okay as well. You can add those patches in, but X39 really should do the trick. And now that X49 has been shown to synergize with X39, you probably need to wear both, okay? Now, swollen ankles, best thing to do is RICE, right? Rest, ice, compression, elevation, okay? That's the start. And then you can place patches on there to deal with the swelling specifically. Glutathione is great. Eon is great for swelling. Ice wave is great because a lot of the reason why you swell in the first place is because of pain. So if you can turn the pain situation down, the swelling goes down as well.
Beautiful. Okay, let's do one more. That was really interesting. Now, what does RICE stand for? Rest, ice,
compression, and elevation.
Compression, elevation. Okay, I put it in the chat. I love learning from you. It's so fun. Okay, Frank, you're our final one for tonight. A high school senior football player has a high ankle sprain, pain and bruising. He was suggested by Connie to use IceWave and X39 at the site during the day and EN at night. Anything else?
Maybe just carnosine, because carnosine helps reduce lactic acid buildup. So anybody who's especially a contact sport athlete is going to be generating a bunch of lactic acid that is not great for our muscles. It makes us sore, it makes us uncomfortable, kind of adds to the inflammation process. So carnosine could be a good add. And just same thing we just talked about, rice, and just make sure that he's taking care of the ankle and doesn't get out there before it's really fully healed, because it'll be a nagging injury all season.
Good advice. Wonderful. Yes, if you have pain, IceWave during the day and EN at night will help you sleep, relieve the pain during the day and night too. So thank you. Welcome back.
Thank you so much.
Great to see you. I've missed you.
Same here. These meetings, sharing space is always so awesome with you guys. So thanks again for having us and conducting these awesome discussions and being facilitators and great leaders and all of that good stuff.
Well, it's our pleasure, and we're so grateful to have you. We're so grateful to have all of you in the audience tonight. There's a lot of you here. If you're someone that's new and you're just checking out LifeWave, get started. We have a wonderful customer program, and if you like to share, a very generous compensation program for sharing, and get started, because there's no risk. It comes with a guarantee, and we're thrilled to have you. Oh, where are you going, Gregory? He's getting tricky on us here. All right. And X39 is the star of the show. It is the vast majority of what people use in all over the world, in over 75 countries, as you've heard. Get started. It's comprehensive. It does so many different things. So, we recommend most everyone get started with X39 and give it, like Dr. Jeff said, 120 days. Whatever is going on with you didn't happen overnight. You will probably see some wonderful benefits much sooner than that, but stay with it, stay hydrated, be consistent, and 12 hours on, 12 hours off. So thank you everyone for being with us this night. And this concludes our call for the evening. And if you want to get your question answered or share something, your story, please put it up in the Q&A early on, because about a dozen of you put questions up after the bottom of the hour. Okay. Thanks everyone. Bye.
Guys, thanks for all the kind words in the chat. I love you guys too.
Yes. Oh, isn't that wonderful? They do love you. Yes. Yes. We love Dr. Jeff, and stay connected. Yeah.
Absolutely.
Go find his YouTube channel. Okay. Okay. Bye, everybody.
Bye-bye.